I'm Dr. Subuga Mushen, an obstetrician and gynecologist working at Chiwoko Hospital. Chiwoko Hospital is a rural community hospital serving 1 million people in the catchment area of Luwero district, Nakaseke and Nakasongola district. People living in this area are majorly peasant farmers who really earn very low levels of income. Chiwoko Hospital has recorded an increasing number of maternity admissions with a total increase in the number of deliveries, both cesarean sections and normal deliveries, since 2010. This has been majorly been attributed to by 4 major reasons. Number one, there has been an expansion of the maternity unit, and this happened in 2010. This was aimed at serving the increasing needs in the maternity unit. This has further attracted more clients to come and access healthcare services at Chiwoko Hospital. We also have a neonatal intensive care unit which takes care of majorly premature babies, but also newborns with several medical challenges. This has attracted several expecting mothers from our catchment area and beyond, such that they are able to access the neonatal ICU after delivery. Furthermore, the greatly subsidized healthcare costs at Chiwoko Hospital have made it possible for the low-income earners in this society to be able to access healthcare services. So this has greatly attracted big numbers of expecting mothers to come and deliver with us. As Chiwoko Hospital and Uganda as a country at large, we've recognized that there is a growing cesarean section rate in our country. This has been attributed to majorly by several reasons. The main indications of cesarean sections at Chiwoko Hospital have been observed to be obstructed labor, which basically means that either the baby is too big to go through the birth canal, or the birth canal is too small for that specific baby. And this normally requires an emergency cesarean section in order to save the baby and the mother. The other reason for conducting cesarean section has been fetal distress, which basically means that the baby's condition generally is not okay, and such babies normally require emergency delivery, or else they may pass on within the mother's womb. Other reasons have included bleeding conditions in pregnancy, hypertensive conditions in pregnancy, among other reasons. Of the patients delivered from Chiwoko Hospital, a significant number of these who require cesarean section are referred in from low-level healthcare units, just simply because the low-level healthcare units don't have facilities to conduct emergency cesarean deliveries. Yet Chiwoko Hospital offers this service in this catchment area. We have referrals from similar level healthcare facilities to Chiwoko Hospital, which are majorly government facilitated hospitals, and they are facing several challenges of infrastructure in that they are unable to meet the growing need for conducting emergency cesarean deliveries at these units. We get referrals from the community through our Chiwoko Hospital community-based healthcare program, where community midwives refer directly the patients from the communities to Chiwoko Hospital who may need urgent care. but also patients walking from their homes to Chuo Hospital on a regular basis. So these are the categories of people we address on a day-to-day basis at Chuo Hospital. There are several integrated interventions to address the growing cesarean section rates, and these ones have been conducted by Chuo Hospital as well as other health facilities in the country, the district, Ministry of Health at the national level. Specifically, Chuo Hospital boasts of a community-based healthcare program, which is called Chuo Hospital Community-Based Health Program. This community-based healthcare program is run by a qualified community midwife, together with community health extension workers and village health teams, who are majorly volunteers. The village health teams, who are volunteers, play a big role in mobilization, sensitization, and health education. For example, in schools, encouraging children to stay in school, delay getting pregnant, hence resultantly reducing the cesarean section rates. The community-based health care program by Chuo Hospital offers community antenatal care through their community antenatal care clinics, which run daily, as well as postnatal clinics, family planning clinics, and all this happen at the community level. This team also identifies high-risk pregnant mothers and those with emergencies in the communities who are unable to easily access health care, and address some of the simple concerns at the community level, while those that are very complicated are urgently referred to Chuo Hospital for immediate health care. In Chuo Hospital, we also have family planning clinics that run daily. In the clinics, we offer routine family planning care and services. Among the methods we offer are the short-term, the intermediate term, and the permanent methods like bilateral tubal ligation. These have enabled people to conceive only when they want, and also to be able to attain the family size that they require and are able to take care of. This has further helped to reduce the number of teenage pregnancies, resultantly reducing the number of cesarean sections that could have been carried out in case of teenage pregnancies, since these are commonly the ones who present with obstructed labor. The other intervention is a daily postnatal clinic. In the postnatal clinic, mothers who have delivered are monitored after delivery to enable them to recover after delivery. This helps to reduce the complications that would arise after delivery, as well as encouraging them to start on contraception. As Chuo Hospital, we've conducted several interventions to address the growing concern of increasing cesarean rates. One of which is very key at Chuo Hospital, is the daily continuous medical education, which we commonly call CMEs. These are conducted by the doctors in their daily doctors' meetings that happen every day in the morning before starting the clinical work. At the ward level, the midwives also have these CMEs. During the continuous medical education, the clinical team is equipped with knowledge and skills to appropriately make diagnosis and proper decisions. This helps to ensure that we offer cesarean sections where they are required and only those cases where they are required. And this has helped us to reduce unnecessary cesarean section rates at Kyoko Hospital. At Kyoko Hospital, we also run a weekly clinic, normally on Wednesdays, and these are carried out by the obstetrician and gynecologist, where identified high-risk pregnancies, pregnant ladies, are reviewed in this clinic. But also, pre-conception care is offered in this clinic. This helps to optimize high-risk clients so that by the time they are pregnant and also delivering, their medical conditions have been controlled. This helps to reduce the number of cesarean sections that would result from the complications of those medical conditions. At your hospital, we've incorporated a key intervention of vacuum-assisted deliveries. The medical teams, majorly the doctors, have been trained in carrying out vacuum-assisted deliveries. The maternity ward has been equipped with enough sets to conduct vacuum-assisted deliveries. This has helped reduce greatly the number of cesarean sections that are being conducted. At Kyoko Hospital, we have developed several protocols that help in the management of labor process. This helps the medical teams to keep up with the standards of care. And in a way, this helps to reduce the number of unnecessary cesarean sections. The Ministry of Health, on several occasions, helps with support supervision of the hospital. In this way, the hospital is able to keep up with the standards of care. At Kyoko Hospital, we have a maternal perinatal death review committee. And this committee basically reviews maternal deaths, perinatal deaths, and near-miss cases. This committee is made up of the Kyoko Hospital medical team, as well as representatives from the community, and these are majorly community leaders like women representatives at the local council and at the district. During the sessions where this committee meets, we discuss factors that have led to these poor outcomes. The community leaders help us to go and sensitize, but also mobilize communities and continue with the health education in the communities. The community leaders who sit on this committee also play a key role in influencing the local council and the district budget processes. So this helps with influencing on where funds should be focused on majorly at the district level. And this helps to improve maternal and child health care. Appropriate, timely referral is key in management of complications of labor. On several occasions, low-level facilities, the community, as well as Kyoko Hospital will require to refer patients with complications of labor to higher facilities. Kyoko Hospital has a 24-hour ambulance system, which is comprised of 2 ambulances, standby drivers, and a nursing team that accompanies patients that are being referred. Patients that require referral to higher level facilities from Kyoko Hospital are offered free referral services. This has helped to reduce the delay in access to the health care service needed. This has been made possible by our partners, the Adara Group. Other clients who are being referred from low-level health care facilities to Chiwoko Hospital also access free ambulance services. This has been made possible through the Ministry of Health initiative called Result-Based Financing. Through the community-based healthcare program of Chiwoko Hospital, village health care teams, together with the community midwife, identify the high-risk pregnant ladies in the communities, link them to care appropriately and timely to Chiwoko Hospital. Despite the integrated approach, at Chiwoko Hospital we've continued to observe a growing need for the caesarean sections. Yet, the infrastructure in terms of the operating space has remained limited over the years. This calls for the expansion of the operating theatre at Chiwoko Hospital, with a specific emphasis on a dedicated maternity theatre at Chiwoko Hospital. This will help to improve the maternal and newborn outcomes. Thank you very much.